begin with a short quiz to see if you had a good sleep last night. Here we go. Question 1. Does anyone know the name of the king of rock and roll?
Elvis.
Do you know who is named the purple one?
Prince.
What was the name of the comedian and actor who worked on Saturday Night Live and was in Animal House?
John Belushi.
Who was the actress who acted with Richard Gere in The Bodyguard?
Whitney Houston.
Do you know what they all had in common?
Sleep apnea.
They all died of opioid overdoses. Do you know that these individuals died from opioids that were prescribed for them? My name is Allie Owens, and I'm going to educate you on the opioid epidemic in the U.S. I understand this topic is extremely sensitive, thought-provoking, and maybe even personal to some. That being said, it is extremely important for you to understand the information being presented because it truly is a topic of life and death, and the information here can help you save a life. Like some of you, the topic is personal to me. As an LVN and having worked in acute care, I have witnessed the outcomes of opioid prescription misuses and its impact on patients and families, especially within emergency rooms. And at the conclusion of this presentation, you will understand the significance of opioid overdose epidemic in the United States, the effect it has upon emergency departments, and the purpose of prescription drug monitoring programs. The main points of today's presentation are to present reliable data that describes the epidemic misuse of opioids in the U.S., to describe the impact on the opioid overdose epidemic and that it's having upon emergency departments, And the third point is a description of prescription drug monitoring programs that have been developed for emergency departments in an effort to control the misuse of prescription drugs. Let's move on to the facts and figures provided by reputable U.S. organizations that clearly describe details regarding the opioid overdose epidemic. According to the CDC, since 1999, the number of overdose deaths involving opioids, for example, oxycodone, hydrocodone, methadone, codeine, morphine, and fentanyl, has quadrupled. From 2000 to 2015, more than 500,000 people have died from drug overdoses. According to the American Society of Addiction Medicine, adolescents 12 to 17 years old in 2015, there were 122,000 that had an addiction to prescription pain relievers, and most were given to them by friend or relative. 48,000 prescription pain reliever overdose deaths occurred among women, and that increased more than 400% from 1999 to 2010 as compared to 237% among men. As a result of the epidemic rate of opioid overdose and deaths, hospital emergency departments have been significantly affected. Here's more data presenting the opioid overdose epidemic on hospital emergency departments. According to the National Institute on Drug Abuse, emergency departments are being impacted due to prescription drug misuses, resulting in significantly impacting emergency room visits. Unintentional overdose deaths involving opioid pain relievers have more than quadrupled since 1999. Recognizing that hospital ERs are reporting an increase in opioid overdose patients and opioid deaths, programs have been developed to screen patients for non-medical opioid use. My final point of this presentation is information regarding prescription drug monitoring programs as a means to monitor and evaluate patients on opioid prescriptions. According to the National Institute on Drug Abuse and the CDC, These are state-run electronic databases used to track the prescribing and dispensing of controlled prescription drugs to patients. Overall, these prescription drug monitoring programs have a positive impact on patient safety. Today I've presented information on one of the greatest threats to health of our society, the opioid overdose epidemic in the U.S. Faced with the alarming increase of opioid overdoses and deaths, the U.S. is challenged to identify solutions that address the issue. Recognizing that hospital EDs are receiving and treating an overwhelming number of opioid overdose patients, the government has begun to encourage hospitals and states to develop prescription drug monitoring programs. These are designed to screen patients and control the misuse of prescription drugs. With the development and implementation of more prescription drug monitoring programs throughout the U.S., individuals will end their misuse of prescription drugs and hopefully return to a healthier lifestyle.
Good door open.